Ouch, I just got a paper cut. Good thing I won't die from it though. Now, this may sound a little overdramatic, but this was a serious concern before antibiotics were discovered. In the past, a minor cut could cause a bacterial infection, and this could be incurable or even deadly. Antibiotics have changed our lives, which is why today I will be talking about one of the world's most widely used antibiotics, penicillin. We will go over the discovery and purification of this wonder drug, how it works to provide benefits, and also its drawbacks. First, let's talk about the infamous accidental discovery of penicillin. In 1928, Dr. Alexander Fleming was studying Staphylococcus bacteria in his lab at St. Mary's Hospital in London. When he went on a 2-week vacation, he left an uncovered petri dish sitting next to an open window. This became contaminated with mold spores, and when he returned, he found that the mold seemed to prevent the bacteria around it from growing. The area around the mold, which was later identified as a rare strain of Penicillium notatum, was clear, as though the mold had secreted something that inhibited bacterial growth. Fleming called this mold juice, a very sophisticated name, but now we know it as penicillin. See, making all those mistakes in your science labs might not always be a bad thing. Moving on, it was now time to purify penicillin from the mold. However, this was harder than expected. Many expert scientists attempted this task, but none succeeded. Professor Harold Raystrick, a biochemist and expert in fungal substances enlisted by Fleming, declared the production of penicillin for therapeutic purposes almost impossible. At this point, Fleming had given up on his attempts to purify penicillin. We're always told to try our best, but sometimes that might not be enough. Sorry, Fleming. So fast forward 10 years later, in 1937, Howard Florey and Ernst Chain uncovered Fleming's research and assembled a team of scientists to work on the Penicillin Project at the University of Oxford. The team struggled immensely to purify penicillin from its original mold, and often there were personality clashes between senior members of the team that resulted in heated arguments over how to carry out the research. Yikes! I think we can all relate to struggling with group work, even as a doctor myself. Anyway, after 3 years, they finally developed a successful but painfully inefficient process that produced pure penicillin. Gallons of mold broth were used to produce a small amount of penicillin, and the team had to use bedpans, milk churns, food tins, and even bathtubs to store the broth. Eventually, special fermentation vessels were developed to hold the liquid. The Oxford laboratory had now become a penicillin factory, but the production of penicillin was still very slow. 6 women, known as the Penicillin Girls, were recruited to work with the fermenting broth and obtain a few milligrams of penicillin from it every week. Working with smelly broth all day sounds like so much fun. So then came the first trial of using penicillin on humans in 1941. Albert Alexander was a 43-year-old policeman, and he had developed a life-threatening infection from a scratch on the side of his mouth that he got while pruning roses. He was the first patient to be treated with penicillin, and he initially showed signs of recovery after its administration. Unfortunately, the supply of penicillin quickly ran out, and Albert's infection returned, causing him to die 5 days later. The low supply of penicillin led to unpleasant measures to increase the supply. Interestingly, around 80% of a dose of penicillin was excreted from people's bodies in their urine, and that could be extracted and recycled. Dr. Ethel Florey, a supervisor for the clinical trials, was on the pee patrol and had to collect patients' urine to obtain penicillin. Yes, that's the real name, and wow, another super fun job. And here is also one of the earliest penicillin samples, which was believed to be isolated from the urine of a patient given the antibiotic. In June of 1941, though, Florey decided to take penicillin to the US to find a way to increase production. He found the solution in Peoria, Illinois, in the Department of Agriculture's research laboratory. The team working there had expertise in using deep fermentation tanks and was able to use them to make the purification of penicillin as efficient as possible. They added corn steep liquor, a byproduct of cornstarch, to the mold broth. This byproduct was rich in sugars, amino acids, and nitrogen, providing an excellent environment for mold fermentation to increase the yield of penicillin exponentially. Penicillin was then made available for British troops on the battlefield in World War II and helped reduce the number of deaths and amputations of troops. Today, penicillin is the most widely used antibiotic in the world and has saved countless lives. This earned Fleming, Florey, and Chain the 1945 Nobel Prize in Physiology or Medicine. As Fleming has famously said, one sometimes finds what one is not looking for. When I woke up just after dawn on September 28, 1928, I certainly didn't plan to revolutionize all medicine by discovering the world's first antibiotic or bacteria killer, but I guess that was exactly what I did. Now, how exactly does this miracle drug work? Penicillin is an antibiotic, which means it kills bacteria and prevents them from growing and multiplying. Peptidoglycan is a molecule in a bacterium's cell wall that provides it with the strength it needs to survive in the body. Penicillin inhibits peptidoglycan production, which means it significantly weakens the cell wall and causes bacteria to die, allowing a person to recover from a bacterial infection. Penicillin is active against gram-positive bacteria, a group of bacteria that has peptidoglycan on the outside of the cell wall, as it is easy for the drug to access the molecule and inhibit production. As a result, penicillin is given to patients to treat bacterial infections. These can include pneumonia, strep throat, meningitis, syphilis, gonorrhea, skin infections, dental infections, and more. All that fun stuff. However, like any other medicine, penicillin has a few drawbacks. Similar to other drugs, penicillin can have side effects. The common side effects are usually mild, though, and consist of stomach aches, diarrhea, nausea, and headaches. Some people have penicillin allergies, though, and this can cause a rash, hives, itching, skin swelling, and anaphylaxis, which is a life-threatening allergic reaction. In addition, penicillin can interact with other drugs as they compete to be removed from the blood and excreted in the urine by the kidneys. These drugs include blood thinners, diuretics, which increase the production of urine, and non-steroidal anti-inflammatory drugs, or NSAIDs, which are specific painkillers such as aspirin. Always let your healthcare provider know about any drugs you are taking to avoid interactions. Finally, penicillin is becoming less effective over time as bacteria have become resistant to the antibiotics designed to kill them. According to the Centers for Disease Control and Prevention, antibiotics should only be used to treat bacterial infections and not viral infections to reduce the number of drug-resistant bacteria in the body caused by regular antibiotic use. Overall, penicillin has changed all of our lives for the better and ensures that we can survive many bacterial infections that we once couldn't before. It has been estimated to have saved at least 200 million lives since its first use as a medicine. Hopefully, you learned more about the wonder drug, penicillin, from this video, and remember to be grateful for it the next time you get a paper cut and it isn't deadly. Thanks for watching.